in this video we are going to see about the blood supply of the abdomen. So the organ requires blood supply in order to get the oxygen and nutrition which is required for their effective function. So blood supply, which includes arterial supply and venous drainage. Arterial supply, which gets the blood from the heart and supplies us various organs and tissues. Whereas venous drainage, which collects the blood from the various organs and supplies to the heart. So the major arteries which involves in the blood supply of the abdomen is the abdominal aorta. So here you can able to see the ascending aorta, arch of aorta, descending aorta, and this descending aorta continues as the descending thoracic aorta, and this descending thoracic aorta continues as the abdominal aorta, and this abdominal aorta is divides into common iliac arteries. So we are more concerned about the abdominal aorta, which supplies us the abdomen. And coming to the branches of the abdominal aorta, there are mainly three branches, such as celiac trunk, superior mesenteric artery, and inferior mesenteric artery. So from the first we are going to see about the celiac trunk, which has further three branches, such as left gastric artery, common hepatic artery, and splenic artery. Okay. So here you can see the branches. This is the celiac trunk, left gastric artery, splenic artery, and common hepatic artery. So this celiac trunk is the artery of the foregut, and the structures which is derived from the foregut are esophagus, stomach, and proximal second part of the duodenum, which so all these are supplied by the celiac trunk. So coming to the blood supply of the stomach and the liver, celiac trunk is the major artery which supplies these structures. So coming to the branches of it, so this is the celiac trunk. So there are three branches: left gastric artery, splenic artery, common hepatic artery. So coming first, left gastric artery, which supplies is the stomach, and it get anastomosis with the right gastric artery. Coming to the splenic artery, which supplies is the spleen and some part of the pancreas too. So this splenic artery gives branches as a short gastric arteries, which supplies is the stomach, and from the splenic artery, left gastroepiploic artery arises and supplies is the stomach. So this is about the splenic artery. Coming to the common hepatic artery is further divided into three branches, such as right gastric artery, gastroduodenal artery, and proper hepatic artery. This proper hepatic artery divides into two, right and left hepatic artery, and right supplies us to the gallbladder. So coming to the gastroduodenal artery, which supplies is the duodenum, whereas right gastric artery which supplies is the stomach. So these are all about the celiac trunk. So in the abdominal aorta, this celiac trunk arises at the level of T12. At the T12, this celiac trunk arises from the abdominal aorta. So coming to the next branch, which is the superior mesenteric artery. So this superior mesenteric artery is the artery of midgut, so which is supplied to the, so midgut is from the second part of the duodenum to the right 2/3 of the transverse colon. So between all these structures are supplied by the superior mesenteric artery. Coming to the branches of the superior mesenteric artery, inferior pancreatico-duodenal artery, middle colic artery, right colic artery, ileocolic artery, and jejunal and ileal branches. So to remember this, I have a mnemonic for you: IMRIIJ. Okay, so that is in my room, I am in jail. Okay, so mnemonic is the in my room, I am in jail. This is in inferior pancreatico-duodenal artery. Second, my, yeah, so middle colic artery, room, right colic artery, I, ileocolic artery, then in ileal branches, then J, jejunal branches. These are the branches of the superior mesenteric artery. So this superior mesenteric artery which arises at the level of L1 from the abdominal aorta. So here we have the, so all these branches have further branches such as this inferior pancreatico-duodenal artery further has 2 branches in it. So we will see about it. So all these branches will get anastomosis also. We will see about it. So first is the inferior pancreatico-duodenal artery. So here you can see the so this is the superior mesenteric artery. So from superior mesenteric artery, first branch is the inferior pancreatico-duodenal artery. So this artery get further divided into 2, such as anterior and posterior. So this posterior is lightened here. So this is anterior, 2 division of inferior pancreatico-duodenal artery. So this gets anastomosis with the, so anterior pancreatico-duodenal artery anastomosis with the anterior superior pancreatico-duodenal artery, whereas posterior get anastomosis with the posterior superior pancreatico-duodenal artery. Okay, so very simple. This is the superior mesenteric artery. First branch is the inferior pancreatico-duodenal artery. Inferior pancreatico-duodenal artery, which divides into 2, that is anterior and posterior. So this anterior get anastomosis with the anterior superior pancreatico-duodenal artery, whereas this posterior get anastomosis with the posterior superior pancreatico-duodenal artery. Okay, so coming to the superior pancreatico-duodenal artery is a branch of gastroduodenal artery, which we have seen in the celiac trunk. Okay, so these are about the first branch of the superior mesenteric artery. Okay, so coming to the second branch, middle colic artery. So this is the middle colic artery. So this middle colic artery divides into 2, left and right. So left and right. So left and right. So right colic artery is dividing into 2. This is the right colic artery, divides into 2, ascending and descending. Whereas ileocolic artery also divides into 2, ascending and descending. Okay, this is the superior mesenteric artery. Okay, so middle colic artery, as I said, it's divided into left and right. Right get anastomosis with the ascending branch of the right colic artery. So this is the ascending branch of the right colic artery. So in middle colic artery, the right branch get anastomosis with the ascending branch of the right colic artery, whereas left get anastomosis with the left colic artery, which is a branch of inferior mesenteric artery. This is all about the middle colic artery. Coming to the right colic artery, as I said, it divides into 2, ascending and descending. So ascending branch get anastomosis with the right branch of the middle colic artery, whereas descending branch of right colic artery get anastomosis with the ascending branch of the ileocolic artery. This is the ascending branch of the ileocolic artery. Okay, so coming to the ileocolic artery, ascending branch get anastomosis with the descending branch of the right colic artery, whereas descending branch get anastomosis with the terminal end of the superior mesenteric artery. So these all are about the superior mesenteric artery. Okay. So this supplies us the midgut. Okay. So coming to the and we have the last branch here. Last branch in this sense, jejunal and ileal branches. Okay. So all these branches from 1 to 4 arises at the right side of the superior mesenteric artery, whereas this jejunal and ileal branches arises in the left side of the superior mesenteric artery. So these are the right side, middle colic, right colic and ileocolic arteries which arises from the right side, whereas this jejunal and ileal arteries arises in the left side. So this jejunal and ileal arteries branches themselves into 20 to 15 to 20 branches and get anastomosis and forms the vasa recta. So these are the branches. These are the branches of jejunal and ileal, and further it divides into branches into 15 to 20 and get anastomosis and forms the vasa recta. Okay. So these are about the superior mesenteric artery. Coming to the inferior mesenteric artery, so it is the artery of hindgut. So it supplies from the 1/3 of the transverse column to the upper part of the anal canal. Okay. So this inferior mesenteric artery continues as the superior rectal artery. It terminates by continuing as a superior rectal artery. And mainly it has 3 branches: left colic artery, sigmoid artery and superior rectal artery. Okay. So here you can see, so this is the superior rectal artery, this is the inferior mesenteric artery. So inferior mesenteric artery continues as the superior rectal artery, and as I said, there are 2 branches: colic artery and sigmoidal artery. Okay, these are the inferior mesenteric artery, and this inferior mesenteric artery just arises at the level of L3. So these are about the blood supply of the abdomen. Coming to the venous drainage, so the main veins which involves here is the superior mesenteric vein, inferior mesenteric vein. As we saw, superior mesenteric artery and inferior mesenteric artery. Correspond to it, we have the veins, that is superior mesenteric vein, inferior mesenteric vein, and the branches are same as the superior mesenteric artery. Okay, so inferior mesenteric also has the same branches which corresponds to their arteries, whereas this is the splenic vein, this is superior mesenteric vein, inferior mesenteric vein. So the portal vein is mainly formed by the union of superior mesenteric vein and splenic vein and forms the portal vein. This portal vein mainly involves in the and related to the liver. 80% of the blood is supplied to the liver by the portal vein. So this is about the venous drainage. So here you can clearly see the formation: portal vein, superior mesenteric vein, inferior mesenteric vein, splenic vein. Okay. So thank you.